Yes, we are talking about hormones. We're talking about perimenopause and menopause and the changes that a woman is experiencing during this time. And we're talking about what is available to help women manage their symptoms during this time. So hormone replacement therapy is very important, but we're not limited to HRT. And what do I mean by that? I mean, hormones are a part of a complex picture called you. So this is when we also do a deeper dive into other areas of you. So how is your stress? How is your cortisol? How is your thyroid function? What about your blood sugars? Do you have insulin resistance, which is then contributing to inflammation? How is your digestive health, your liver, your gallbladder? All of these will impact how you feel and how you are processing your hormones. So hormone optimization includes laboratory testing, so understanding your hormone picture and looking at how you are metabolizing your hormones. So if your hormones are not being metabolized efficiently, or maybe you're not clearing your hormones because you are constipated or you have sluggish liver, gallbladder functioning, these can all impact how you feel and how you are responding to hormones. So when looking at hormones, we also like to look at vitamin and mineral levels and optimizing your vitamin and your mineral levels, supporting your mitochondria. Your mitochondria can impact how well your hormones are working at a receptor level, so how you're responding to hormones at a receptor level, and then also your stress levels, because stress can impact your overall health and how you feel. So, and of course, let's not forget the most important. So diet, nutrition, are you getting enough sleep? Are you managing your stress? All of these are important in how you feel and optimizing your hormones and overall longevity medicine. So HRT works better and we feel better when our systems are working efficiently and optimally. So again, some of these systems that we're looking at, your liver health, your gallbladder health, is there inflammation? Is there insulin resistance? How is your digestion? How is your thyroid? How is your cortisol? How are your vitamin and mineral levels? All of these can influence how well our hormones are working in our body and overall how we feel. So this is the approach that we take at Vitalia Healthcare, a whole body approach when we look at hormone optimization and longevity. Thank you.